All right, so our next speaker is going to be Caroline Rudisill from the University of South Carolina. So, Carol, take it away.
All right, thank you so much. I'm delighted to be, presenting our preliminary results from our Pilot C grant that we are just so thankful for. It's frankly been a lot of fun to work on this project. We have a great team, so thank you for funding it and allowing us to do this work. We've looked at how trust in health systems, changes in people's household finances have impacted the way they interact with the healthcare system. Today, we're just looking at descriptive data and comparing what we saw in our survey in 2020 to what we saw in a recent survey. But I'll go at the end and talk more about what our plans are in the future to look at these relationships. We have a wonderful team who are just a great group to work with. Many of us from University of South Carolina, also colleagues from Europe who I've collaborated with. And I wanted to flag two of our students who've been integral to this project who are both here at the conference. Katie Bond, part of a T35 program with our Big Data Health Science Center at the University of South Carolina, worked with us this summer, had never opened Stata before working with us, and now is just showing me models and asking me great questions. So I think that's an achievement right there. And then Anna worked with me from the beginning when the grant call came out and helped write the grant proposal, helped identify common data elements, helped put the survey together, get it in the field, and also is doing analysis. So great work from our students, so thank you. All right, so the background, a lot of this we've been talking about today, so I won't have to do a lot of detail here, but as we all know that trust is critical in the way that folks you interact and use the healthcare system. But COVID has had some very serious and important changes that we have to recognize and think about in the way that folks will use healthcare in the future and have been using healthcare since the pandemic. So of course, we know there's been disparities in the way folks' health outcomes have ended up during COVID, but also differences in the way people say that they trust in the healthcare system during the COVID time and today. We know that there's been temporary and permanent changes in the way that we can use health systems, as has been discussed this morning, and understanding what's been reimbursed, the different modalities that can now be used, and so on. And then, of course, there's been changes in folks' finances. We just heard about that in some populations, but we're looking broadly, kind of national wide, and trying to understand how the shifts that we've seen, so stimulus payments, mortgage relief, all the things that have changed, inflationary environment, all the things that are coming into the mix now and are affecting people's household finances. Yes.
I think that's being shared.
Oh. Oh, that's fine. Thank you. Okay, so today I'm just going to focus. We have two aims on the project. I'm going to focus just on aim one. This is looking at how trust and household finances impact healthcare utilization and health behavior during the COVID-19 time and during the present period. I like what someone was calling it today, the late COVID period. So I might use that as we were writing the article. I like that because we can't say post-COVID, right? And then we are going to look at differences across gender, age, and residence rurality. But today, I'm not even going to get into the subpopulations. I'm just going to talk about our main findings so far. So a bit of what did we do, the methods here. So in 2020, our group received funding from the Vice President of Research Office at the University of South Carolina to run a survey that Ipsos Mori put into the field for us. So remember July 2020, kind of pre-vaccine, height of uncertainty, one might say. We knew vaccine was in development, things were looking good, but there wasn't something out there, but we did have some effective ways of handling COVID clinically. And then our second survey, which is what this pilot grant allowed us to do, and went to the field in May 2023. So we had about 1,000 people in July 2020 and about almost 2,200 people surveyed in May. These are representative populations in the US. So we use weighting to be able to look at this and say that they're nationally representative. I'm just flagging here the key variables in our surveys that we'll look at today. So in both 2020 and 2023, we asked folks about their trust in local and national government as well as healthcare providers. We asked them about their household finances before the pandemic and now. We asked them, in 2020, we did not include health literacy, so we added that in 2020. We have 4 measures of healthcare utilization. It's of course self-reported, asking folks about annual health checks with their doctor, phone-based consultation, their likelihood of doing these things. They're using the internet to consult with their doctor virtually, and then the use of pharmacy-based healthcare services. And then we looked also at healthcare behaviors, so flu vaccine, exercising, and eating healthily. And then on the right-hand side, I'm not showing regressions today, but these are control variables that Ipsos Mori supplies us. So we have lots of information about the features of these populations that we can, goodness, 5 minutes left. Okay, 10 minutes is tough. Okay, I'm gonna fly, get ready. All right, so the question we asked is a Likert scale response. This is gonna be our dependent variable. How are you more or less likely to do the following things asked in 2020 and then asked in 2023 relative to before the pandemic? Okay, so that's kind of important. This is just key demographic variables. You can see that across gender, age, urban, rural, similar populations in 2020, 2023. I should have flagged this. This is a repeated cross section. So it's not the same people in 2020 and 2023. We're not following anyone. We are just going back to the same pool of people that Ipsos Mori can ask questions to and asking them the same questions, that group, the same questions again. Okay, highlights here. So in yellow, I've highlighted 2 kind of key things. First of all, trust in national government between 2020 and 2003 climbed significantly, and mistrust fell between 2020 and 2023. Healthcare systems, no change across the years, but on the next slide, you can see the arrow going across at the top there. Healthcare systems have always been the entity of those 4 that people trusted the most. So that stayed the same in 2020 and 2023. It's already very high. But we see on the left-hand side, the national government, we see that increase in trust and decrease in mistrust. For all that the World Health Organization was talked about, we don't see much in terms of change across those years. So I found that kind of interesting. In local government, small changes, but nothing really that notable. Household finances, we see that more people moved away from saying there's no difference in my household finances between the years. So something happened to people basically either way for the most part. Either things got better or they got worse. So we see kind of 2 effects going on there. And in terms of use, so the key things here are, if you look down there at the bottom under somewhat more likely and much more likely, we see that in 2020, between 2020 and 2023, we see an increase in people being more likely to get their annual health check. We also see the same thing if you go all the way across the bottom to pharmacy-based healthcare. So we see that folks are increasing their likelihood of using both of those types of services. Whereas with phone consultation with your doctor and remote consultation, people are self-reporting no increase. So if we saw an increase in 2020 from prior to the pandemic, but we didn't see that there's a sustained growth in those activities. I'll skip this for time. Another piece is on exercise, similar kind of signals with eating healthily and exercise. One of our team members wants to call this first paper is the COVID-19 a pro-health tipping point, because perhaps folks, we see that they're also increasing, they're much more likely to be eating healthily, exercising, and a decline in those things, but they're so much less likely over time. Seasonal influenza vaccine, as you might expect, we get people who are saying, I'm increasing the fact that I'm much less likely. There's more people saying they're much less likely, and there's more people saying they're much more likely to get the flu. So I think that's what we might expect, right? People at both ends have stronger preferences over time. I'll skip my summary of results for time purposes and just let you know what our plans are. So we have kind of finalized base case models to predict those healthcare behaviors now, controlling for the various respondent characteristics. And we've tested whether there's biases in our models based on the fact that we are dropping people who respond, don't know, and so on. And so far, we don't see selection effects. We're examining stratifying results in interaction terms and putting together a manuscript for what I just showed, as well as the regression results that show relationships. Our aim too is focused on adding health literacy into the conversation, that relationship between how people trust in health systems and health literacy. We know that there's some possible interactions there. So we've measured trust a few different ways for our survey in 2023. So we'll look at different measures of trust in the community, not just the health system, but trust in others, and what that means for use of health services along with health literacy. So we have all our data and we're enjoying crunching the numbers and getting some manuscripts put together right now. That's all. Thank you.